So again, you want to go ahead and take out some notes, and this free crash course is being brought to you by LW Pharmacy School. Okay, we're going to jump right into it. So the reason why we're going to talk about pharmacy billing tonight is because a lot of what's going to be on your exam is coming from the pharmacy billing. Remember, the exam is catered towards retail pharmacy, okay? And so it's important for you to understand how the retail pharmacy operates as well as the billing. The billing is very, very important to you, okay? Managed care providers. And so your managed care providers is HMO, that's your PPO. And HMO stands for Health Maintenance Organization. Health Maintenance Organization is what an HMO plan what HMO stands for. Okay, healthcare providers. Healthcare providers work directly for HMOs. Okay, so that's your doctors, your nurses, pretty much anybody, the physicians that are providing any type of healthcare services to you or to the individual. Your PCP. Now, with an HMO plan, you will, be required to select a PCP. The PCP is the primary care physician, and that is the individual that the patient goes to see whenever they're having some questions or, some worries or things like that about their health. They are going to see that particular PCP doctor, okay? And then there's a small copay, okay? So whenever you go to the doctor in an HMO, there may be a $30 copay, there may be a $40 copay for regular visits, and then if you are seeing some type of expert or some type of specialist, then that copay may increase a little bit, okay? So those are just some of the things you want to know about HMO, okay? Let's move on to PPOs. Now, PPOs is the Preferred Provider Organization, the Preferred Provider Organization, okay? And that PPO provides healthcare services to members at a discounted fee for service, okay? When you are working with a PPO, you can use any doctor in network or any doctor out of network, and that's the advantage of having a PPO. Members will pay a copay at the time of service, and, they may be able, again, to work with whomever they want to work with outside of their network or inside of the network. As to where here, HMOs, it has to be in network, okay? It has to be in network for an HMO, have to select a primary care physician, and then you have to get a referral if you want to go and see a specialist, okay? Now, for some people, that may not matter because you have some people who don't really go and see specialists a lot, and so they say, well, I want the HMO. Typically, an HMO plan is a lot cheaper than a PPO, okay? Here, we're going to talk about a little bit about the federal funded healthcare programs. Now, federal funded healthcare programs is Medicaid or Medicare, okay? There's an easy way to remember the 4 parts of Medicare, and this is where you may want to take some notes if you haven't started already. Part A covers hospital. Part B covers medical insurance. Part C covers, allows the patient to obtain coverage through an HMO or PPO that provides additional services. And then Part D is for prescription drug plans, okay? I'll repeat that again. Part A is hospital. Part B is going to be medical insurance. Part C is any additional coverage that the patient may need. And then Part D is going to be the prescription drug plan. And that's when we come into the picture, okay? And so when a person or an individual who is using Medicare, they need to make sure when they get ready to come to the pharmacy that they provide us with that Medicare Part D card, or that they have that somewhere in their plan, because that's what's going to cover their actual drug prescriptions. It's not going to be Part A, B, it's going to be the Part D that covers it, okay? And so we want to make sure too that when those individuals come into the pharmacy, that they can provide that type of coverage and show us that they actually have it. Now, this is going to be very crucial to you because inside of the pharmacy is where all of this stuff really matters, okay? But it also matters on your PTCB exam. Remember, the exam is catered towards retail pharmacy, community pharmacy, and that's because the majority of individuals inside of the world goes to a retail pharmacy, not necessarily a hospital or an outpatient. It's always retail, okay? So your test is geared towards the retail pharmacy. It is really your responsibility to educate yourself on the billing inside the pharmacy as much as you possibly can. Okay. The next program that's federally funded is Medicaid. When you think about Medicaid, think about women and children. Think about women and children with Medicaid, okay? So you have Medicaid and then you have CHIPS, okay? You think about children, and typically for kids, they need to be under the age of 18 and under, and then women, you know, are normally pregnant, and so those are the ones that can actually get the Medicaid. And it's based on income and other circumstances, okay? Each state determines its own eligibility rules, services provided, and copays. The eligibility goes on a month-by-month basis. So if a person has it this month, they need to make sure, you know, that their eligibility stay intact for the next month in order for them to continue to receive services. That's another reason why when patients come into the pharmacy, we want to update their profile and we want to update any information that they give us. We also want to ask them, hey, has anything changed? Has your address changed? Has your phone number changed? What about your insurance? Because those type of things matter when it comes to making sure that when we submit the claim to the insurance that we're going to get a paid claim. We don't want to get a claim, especially after we've told the individual, hey, you know, it's going to be 45 minutes in order, you know, for you to get your prescription, and then when they come, you know, it's like, well, it's been 45 minutes, but we didn't get a paid claim. That's pretty irritating to the customer, okay? And so again, one of the ways that we can prevent that is just making sure that we update their profile information as much as we possibly can whenever we see them. Pharmacy reimbursement from managed care, okay? AWP, this is another good one you want to write down. The AWP stands for average wholesale price, okay? This is not regulated by the government and it does not take into account any discounts, okay? So again, AWP is average wholesale price, okay? It is the average price that a wholesaler sells a medication. AAC, actual acquisition cost. That is the actual cost that the pharmacy paid for the medication, okay? So when we talk about the AAC, the pharmacy can charge an AAC plus a dispensing fee in order to try to make some of that profit back, okay? And so again, you wanna make sure if you're not taking down any notes, this is a time for you to kind of get in there and start kind of jotting some things down, because these are some very crucial terms that you will see on your board exam, or if not on your board exam, you will actually see these inside the pharmacy as well as you work your way up. And so I encourage you to take some of these notes here. And then the next one is the maximum allowable cost. Okay, this is used when it's time to calculate the reimbursement formula for generic medications, and the maximum allowable cost is going to be, you know, one fee. So you may have $10 for the maximum allowable cost, and then you may have a dispensing fee of $2.50. Okay, and that's typically determined by the managed care organization. Who is the managed care organization? That's the HMOs, like your Blue Cross Blue Shield, your Aetna, okay, your Humana, okay, PPOs, okay. Still, Blue Cross Blue Shield also has a PPO plan. So does Aetna, so does Humana. It's almost like, you know, you can go to McDonald's and you can say, hey, I don't want to supersize my meal. I just want to get the regular meal, okay? So the regular meal would be the HMO, and then PPO could be compared to supersizing. So I just want to let you know that pretty much every organization, every healthcare organization, managed care organization has HMO and PPO for both, you know, to offer to both individuals, or to offer to individuals, period, okay? Online adjudication. Online adjudication is something that is pretty cool and pretty fascinating, especially when you're working inside the pharmacy. And you'll see this quite a bit, where you are processing a prescription, you know, electronically to a third-party provider. And as soon as you process the prescription, you get a, you know, a receipt, and learning or seeing that the claim was actually processed. And that's pretty cool, because it's just as quick as tapping the button. As soon as you click that button, that provider or that third-party provider has just now received that claim, okay? And they can either deny it or they can keep it. It's just kind of up to them. And it's so the online adjudication is the process by which a pharmacy submits prescription claims electronically to a third-party provider when filling a prescription to ensure accurate co-payment and timely payment, okay? When we are inside the pharmacy and we are submitting these particular payments to a third party, it's important that at that time we submit it as soon as we type up the prescription, we're going to press enter and we submit it. Once you press enter and you submit it, typically a leaflet will pull out, and that's pretty much the hard copy that the patient is going to get. And that prints out and that lets us know that, hey, we've gotten a paid claim. And then if nothing prints out, or if something prints out that says a rejection, then, we know that the prescription has just got rejected and now we have something else on our hand. And I don't want to get too far ahead of myself because we're going to actually talk about rejections tonight. One of the advantages of being able to do online adjudication is it provides an immediate response from Medicare Part D. Remember, Medicare Part D is for a prescription drug plan. So when you see Part D, think about the D standing for the word drug, okay? Medicare Part D, and then you have Medicaid, and you have other insurance providers. It provides coverage information, reimbursement rates, and copays, okay? It also allows the pharmacy to verify a patient's eligibility, to determine the plan name, the patient identification, and group number, okay? All pharmacies will possess a national provider identification number, okay? That is considered an NPI. All pharmacies will possess a national provider identifier number, okay? So when I used to work in the pharmacy, and let's say I had a patient, who had some issues, and I had to call the insurance company. And whenever I would call the insurance company, they would ask for my name and ask for my position. And then the next thing they wanted to know is, can I get your NPI number? Typically, your NPI number is going to be at the top of any station that you can type at, really, when you're, doing the data entry. It's also going to be at stations where, you can actually call. There are some pharmacies that have the phone station set up where that station is just, straight for actually making phone calls out of the pharmacy, okay? And so that NPI number is not something you need to remember, but you do want to know what it stands for. And it's the National Provider Identifier. National Provider Identifier, okay? And so again, when you are calling into the pharmacy, you want to make sure, into the insurance company, you want to make sure that you can locate that NPI number and give that number to them, as well as if you saw this on your exam, you want to make sure too that you know what the NPI stands for, okay? So I'm going to move throughout this as quickly as I possibly can. We have a game at the end to play, and so I want to make sure that we can cover everything that I have prepared for us today. When you are doing the online adjudication, please make sure that you are typing the correct prescription, because if you are, let's say the doctor ordered 30 and you type 60, the patient could get charged more. And so again, that goes back to data entry and making sure too that you are following the medication safety rules as well, okay? Because we don't want to overdose a patient or give them too much medication that they're not supposed to have. Prescription processing. Prescription processing. When you are processing the prescription, and let's say, the customer brings in their insurance card and things like that, you want to make sure that that card has the correct BIN number on it, the correct plan code, group code, issuer, okay, which is whomever the card is issued from, normally a number like what you see here. ID number. The ID number is going to be the member number, okay? And typically, when you are, this one here is a drug card, and so for this particular card, you're probably not going to have an ID number because this is a card that anyone can use. Now, this is a private insurance card, and it's a PPO. And if it was HMO, it would still look the same. And you can start, if you have insurance, you start looking at your cards too and kind of getting familiar with it and getting acquainted with it so you can, realize what the format and how it should look. Okay. Now, the BIN number is here. And so BIN stands for bank identification number. Bank identification number is the BIN. That should always be on the card, okay? And then the next one is the plan code, okay? Now, again, if you are working with a discount card, you're going to see that the plan code is going to be the PCN, okay? And so again, we want to make sure too that when you are putting in the information into the system, all of this is appearing on the card, okay? Then you have the group code. So there's a group code here, and let's see if we can find, there's one there as well. We have the ID number, and so normally Blue Cross Blue Shield, Aetna's, a lot of the private insurance always starts with a letter. The subscriber card holder name. So this is the person who actually is the holder of the insurance, okay? So if someone is married and their spouse is the one that carries the insurance, they're going to be the subscriber, okay? So if it's their spouse, their spouse will always be the person code 01. And then any type of dependent that is on the insurance is going to be 02 and 03. So if you look here, you'll see that the subscriber is John Doe. So we can already assume and know that he is the one that holds this insurance for his family, okay? So his person code is 01, okay? Now his wife, we're going to assume it's just a wife, is Jane, and her person code is 02. And then Sam, we're going to assume this is the kid, and his group code or person code is 03, okay? When you are typing in a prescription for an individual who may be, if we were typing up a script for Jane, we want to make sure when we put this insurance information into the system that we select Jane as the spouse, and we select her code as 02 for her person code and not 01, because that could also get a rejected claim as well, okay? So it really does matter about those person codes. Copays should be listed here, and so you have a primary copay of $25. That's if they're going to go see a regular doctor, and then the specialist looks like it's about $50 or more, okay? And then all of their other stuff is listed here. And then it tells us for a prescription or preventative care, there's no copay. But if we're getting prescription drugs, it looks like it's 10, 25, and so on and so forth. I can barely see that writing that's pretty small. And then there should also be some type of help desk phone number that we can call in case we have any questions in the pharmacy, and we can, kind of call and get some understanding as to what we should be doing. DAW codes. Now, I'm so serious about this. If you have not written down anything else, you better write this down. This is going to help you pass your PTCB or EXCPT exam. This is important. If you look at the blueprint, you will see DAW codes there. Don't sleep on them. They are here to help you, okay? So, DAW stands for dispense as written. 0 means that the doctor did not select that, it needs to be generic or brand name, which means that you can fill it, any way that the patient may request. 1 means that substitution is not allowed by the provider. What is a substitution? I'm glad that you asked. A substitution would be if the doctor wrote it for brand, then you cannot substitute it for generic. Or if the doctor wrote it for generic, you cannot substitute it for brand, okay? So no substitution whatsoever. DAW2 is substitution allowed by patient requested product dispense, okay? So that means that if you have a patient who requested, that they want brand instead of generic or generic instead of brand, then that's fine, you can do that. Substitution allowed, 3 is substitution allowed, pharmacist selected product dispense, okay? That means that the pharmacist was the one who selected this, and the doctor has given the pharmacist permission to do so, okay? Remember that we're all a team, okay? We're all a team, and we're all a part of that managed care therapy, okay? We're all a part of the medication therapy to make sure that the patient gets better or gets what they need. 4 means that substitution allowed if the generic drug is not in stock. Excuse me. So if the generic drug is not in stock, then you can substitute it. Number 5, substitution allowed brand drug dispense as generic, okay? Number 6 is an override. 7 is a substitution not allowed. Brand drug is mandated by law. That means by law, this person has to have it, and that is a really, big issue there, and that's something that you don't want to get involved in. So if I were you, I would just submit it and type it up, fill it the way you're supposed to. And if you don't have the drug, that's okay. Tell the patient, hey, we don't have this drug. We can order it by such and such date. And if you're working at a retail, pharmacy like Kroger's or CVS or Walgreens that, has multiple chains or multiple locations, you may be able to call a neighborhood store and say, hey, do you guys have this medication in stock for Jane Doe? And then if they do, you can move forward in that direction. If not, the last one is substitution allowed, generic drug not available in marketplace. Okay, so that just means that substitution is allowed. So hopefully you guys got this down. If you didn't, this video will be posted and you can go back and watch it as many times as you like to get as much information as you may need. Rejection of claims. Prescription claims that are rejected will have at least one rejection code, okay? Possible reasons for rejection could be a missing or invalid BIN number, missing or invalid transaction code, missing or invalid pharmacy code, missing or invalid group number, missing or invalid birth date. These are some of the reasons that a prescription can be rejected. Okay, so you want to familiarize yourself with these as well. When you get the opportunity, please make sure that you write this down and use it and put it, add it to your collection of material that you're studying from. PAs is what I call these, also known as prior authorization, but when you're in the pharmacy, you call it a PA because you get used to seeing them sometimes and you just refer to them as a PA. PA requires a physician to obtain approval from a managed care organization. What is a managed care organization? We've talked about this. It is an insurance company. Okay, so it requires a physician to obtain approval from a managed care organization for a specific medication before it is dispensed by the pharmacist. Sometimes insurance companies or managed care organizations require that a person or a patient take the generic drug before they take the brand. And so let's say a doctor says, hey, I'm going to write you for a Moxil 250. And then we submit it to the insurance company. And then they say, hey, they reject it for a PA, and they say, why do you have to use a Moxil? Why can't you use a amoxicillin? And then the doctor at that point will need to complete an extra step to make sure that they appeal to the insurance company as to why they are requesting them to take the brand, okay? Situations that may require prior authorization can be brand name medications that have generics available, like Amoxil and amoxicillin. Expensive medications. I've seen some medications cost as much as $1,500. I know, it's crazy. Medicines with age limits, such as retinol. And then drugs used for cosmetic purposes, such as, when people have alopecia, they're like, okay, what do you need this for? Is this really a medical issue? Is this really a medical necessity? And so those are some of the times that PAs can get involved, and it can get a little sticky too. And when you get a patient who has, a PA and they have to get a PA done, be as patient as you possibly can with them because they don't understand this process. And a lot of times when they come to the pharmacy, this is their first time hearing about a PA. They've never heard about it before. And they're looking to you as the expert because you are the expert inside the pharmacy. You are a pharmacy tech. And so, or a pharmacy assistant, and you're working alongside of a pharmacist who has a degree. And so, they're the expert in their world, and then you're a tech. And so you're expert in the tech world. Okay, and so typically techs are the ones that kind of deal with the billing. And so with that being said, if they ask you about, hey, why do I need a prior authorization? You just explain it to them very nice and calmly. And you just say, hey, this is what's going on right now. It's out of our control. We're going to contact your doctor. We encourage you to contact your doctor as well to make sure that everything gets resolved the way that it needs to. Plan limitations, okay? Normally, a typical plan or typical health insurance company or managed care company will allow between 30 to 90 days for a script. Okay, they will not allow you to get, or the patient to get 120 days of medication or 365 days of medication. they typically only allow between 30 and 90 days supply, okay? 30 to 90 days supply is what the insurance company will allow, okay? Drug benefit limitations is the dollar limit. That's the maximum amount that can be spent at one time on a prescription. And so, you know, if the prescription is $500, your insurance might just cover 20. They may just cover 250. You know, you may get lucky and they cover 400. But they have a maximum allowable amount that can be covered or be spent on each prescription that is there, okay? The maximum number of prescriptions that can be dispensed to a member over a period of time is normally monthly, which is your 30 days, okay? And so we definitely don't want to tell the customer, oh yeah, we can get you 120 days worth. No, no, no. Maybe if they're paying out of pocket, but not if they're dependent upon a prescription or a managed care organization, okay? Deductibles and copays, okay? So at the beginning of the year, pretty much each insurance company has a deductible, and that deductible must be met before the insurance will kick in and cover, certain parts of the medication. And so you have different types of, the deductibles and how they actually work. And so some people may have a $5,000 deductible, some may have a $1,000 deductible. It just kind of depends on their insurance and what they've selected. But a deductible is a predetermined amount of money that must be spent on prescriptions before the copay begins. So if the deductible is $500 and that person's, prescription only costs $25, they have a long way to go until they get to the $500, okay? Types of copays, you have fixed copays, percentage copays, and variable copays. We also encourage, especially insurance company, encourage the use of generics and formulary drugs. As long as you can stay on the generics and the formulary drugs. Formulary are drugs that have been pre-selected for patients to use. You have a formulary list and then you have a non-formulary list. And so non-formulary list is any drugs that are listed that have not been approved by that particular managed care organization. Okay, and if it haven't been approved, probably going to need a PA for that. Okay, math formulas. You want to write these down. We're going to wrap this up because we're going to get into our game. But math formulas, this is what you want to write down. Remember, we talked a little bit about business math for the pharmacy. Here are some formulas that I want to give to you guys, and I want you guys to write these down. In order to calculate the cost, you're going to add the purchase price and the cost to dispense together. If you're calculating a discount, you're going to multiply the purchase price by the discounted rate. If you're calculating the discounted price, you're going to subtract the purchase price or the discount from the purchase price. Gross profit is always going to be the selling price and the purchase price, or you're going to subtract the purchase price from the selling price. The markup price is going to be the purchase price minus the selling price. So gross and market is pretty much similar. Net profit, okay, that's going to be the overall cost times or multiplied by the desired percentage profit, okay? The overhead is the sum of all expenses that are hanging on top of the head. And then the profit is the selling price, okay? So if we're calculating the profit, it's going to be the overall cost subtracted by the selling price, okay? Patients' rights of medication safety. You need to know that patients have rights, okay? They have the right to the right drug, the right dose, the right dosage, the right route of administration, and the right time of administration. They have that right. Medication errors. There are 3 types of medication errors that can occur. You have a prescribing error, dispensing error, and administration errors. Again, this is where you want to make some notes. How many medication errors do we have? 3. 3, okay? Medication error reporting. If for any reason we are reporting medication errors, we are going to report them to FDA MedWatch, the ISMP, FDA via FEARS, IOM, TJC. Hopefully you know what TJC is and who they are. We're also going to report them to United States Pharmacopeia. And these are just some of the companies that you can, or organizations that medication errors should be reported to, okay? These are some of the organizations that medication errors should be reported to, okay? We are going to go ahead and move on over into our game. And so hopefully you guys have enjoyed the first little 30 minutes of our session tonight. This is very exciting for me. As we go into our game, I'm going to show you some things. Now, this is going to be about the top 200 drugs, okay? And so what I've been able to do is I've been able to kind of pull together some of these drugs and put them inside the games. Sorry, guys. I know you can hear all of this clicking here. And so in this game, we are going to play learn these top 200 drugs, and it's not going to be all 200 drugs. It's about 20 of them, and we're going to try to get to them, and we'll close out our session with them, okay? What you're going to do, and this is how you're going to play, you are going to make sure that you type in your answer inside of the chat, okay? So if you think you have the right answer to the drug, you are going to type it into the chat. I have my chat box open. Okay, so everybody, let me know if you can see my screen. Can you see my screen? Okay, if you can see my screen, please type yes, 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 yes. If you cannot see my screen, please type no, 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 no. Okay. Okay, can you see my screen? I want to go ahead and get started with you guys. So, yes, thank you, Megan. You always are a lifesaver. It's always great to have you on. I'm so glad that you guys are here with me tonight. You could have been anywhere else in the world, but you're here with me, and I'm grateful. Okay. So what is the generic for Celexa? What is the generic for Celexa? Can everybody see the choices? Let me make sure you can see the choices here. I'm trying to zoom in as much as possible without cutting them off. Okay. The generic for Celexa. What is the generic for Celexa? Can everybody still see my screen? Hopefully you can. Yes, yes, yes. Okay. Well, if you cannot see my screen, please make sure that you say so to me. Okay. Yes, no, maybe so. Looks like everyone can see. Okay, so the generic for Celexa is citalopram, okay? I want you guys to participate as much as you possibly can, but for time's sake, I'm gonna move through it, and hopefully you guys can type. Okay, good. Megan put it in there. Thank you, Megan. Celexa, okay? And so the correlation there, and if you can kind of, catch this, they both started with C's, and so hopefully you can kind of remember that. We don't always get so lucky where we can always find the relationship between the drugs, but whenever we do, it's really nice, okay? What is the generic name for Prevacol? The generic name for Prevacol, okay? Now, I want to show you this one. If you look at PRAVA, and then you see the PRAVA here, that lets you know that that could be it, right? Because it's in the same family, okay? And then anything that ends in a statin, what are statins used to do? What are they used to do? Are they used to lower your cholesterol? Oh, maybe they are, okay? And so Preva here, Prava, Prava, okay? And these games have been brought to you by DenaliRx.com. If you are interested in, being able to play these on your own, please go onto their website, www.denalirx.com, and sign up so you can play these games. They are a lifesaver, and a lot of my students have really appreciated being able to play them, okay? What is the generic name for ProAir? Generic name for ProAir. What does this look like? This looks like it may be, anybody want to take a guess? Generic name for ProAir. Albuterol, okay. What is the generic name for Flexeril? Flexeril. Anybody want to take a guess outside of the one who's been taking a guess? Anybody? What was it?
Cyclobenzaprine.
Yes, cyclobenzaprine. Yes, very good. What is the generic name for K-Flex? Generic name for K-Flex. Now, let me show you something, okay? Look at the Lex here, and then look over here, and you see Lexin, right? So sometimes these drugs will tell on themselves. Remember, I told you the best way to remember your drugs is by prefix, infix, and suffixes. Try to find a relationship. You know, how does this look? Now, it may not always work like that, and we know that. But when it does, let it work for you, okay? And there's nothing wrong with guessing and, you know, trying to see, okay, well, I don't really know what this drug could be, but let me go through and see if I see any type of relationship there. Okay. Please be sure to mute yourself. We don't want to catch your background if you can. So glad that you guys are on with us tonight. So please try to mute yourself as much as you possibly can. What is the generic name for Flonase? Flonase, okay? So let's look at this. This one has AS, and you know, it's a little tricky. So I see AS here, and then I see AS right there, okay? And then at the top, or in the beginning, which is your prefix, I see the FL, okay? FL there. So I said, oh my God, those are some relationships, and I know, you know, that that may be the answer, okay? Now, Coumadin. What is the generic name for Coumadin, okay? Now, I look at the IN here, and then I see the IN there, okay? Very good. Please try to mute yourself as much as possible. I do appreciate you guys participating, but I want to make sure everybody can hear. Thank you so much. Again, I just can't express to you how much it means for you guys to be here with me. So again, thank you for that. The generic name for Ultram, okay? You see TRAM, Tramadol. I mean, it just pops out at you. I'm telling you the truth. It just pops out. Prozac. Now, this is one where you may not be able to find the relationship there. And you may, you know, have to just kind of know this one. For this one, you're going to just have to know it because it's not going to be any hints. Also, if you want to participate and answer some of these questions as I'm answering them or asking them to you, please put your message and your answer inside of the chat box. That's what that is there for. So that chat box is interactive, and we can all kind of see, and that way everybody that's in here tonight can see it as well, okay? So please make sure, again, if you want to participate in answering the questions that you put inside of the chat, okay? Prozac. Now, this one you just got to know, you know, what that one is in order for you to get it correct, but it's fluoxetine, okay? Generic name for Advil. Now, Advil is a pretty common drug, isn't it? It is a pretty common drug, Advil, okay? What is the generic name for Advil? Anybody know what the generic name for Advil would be? Ibuprofen. We learned last month that ibuprofen is a non-steroidal anti-inflammatory drug. Non-steroidal anti-inflammatory drug. That means that it fights against inflammation. Okay, so we're going to select ibuprofen. Now, this is a good one. Steropred. Okay. Now we see the PRED. PRED. Now I'm going to go down. Oh, PRED. Suffixes, prefixes. Brand name, Steropred. Generic name, prednisone, right? Oh, I'm telling you, this is like going to change your life. You are getting some good things tonight, okay? Now, Neurontin. This is ending in NITIN, and gabapentin is ending in NTIN. Yes, very good. Very good. I think Elder Pruitt is on. Good to see you. I always like to see people that I can recognize. So thank you. It's good to have you with us tonight. Oh my God, I'm so excited. Everybody's in the building. Klonopin. Clonopin. Which one is that? I'm looking over there. Do I see anybody? Do I see anyone? Clonopin. 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 Anybody want to take a guess? Clonopin. Now I'll tell you, okay, so there's an O, sorry. There is a L-O-N here, and then we have L-O-N here. Yes, okay. So that's what it was, okay. Now, I see lorazepam, and that could be a little tricky for you, but the correct answer was clonopin and clonazepam, okay. And then the last one we're going to attempt is Plavix. Plavix. Oh, where is Plavix? Anyone want to tell me what Plavix is? Plavix. Okay, does anybody know what Plavix is used to treat? Plavix works against clotting. It is an anti-clotting prescription. Anti-clotting prescription, okay? Anti-clotting. And I am going to find the generic for you, and here it is. Yes, very good. Now, I won't try to say this because I don't want to butcher the name, and I know that, you know, that's not my forte, okay? But for the clotting, you see clotting starts with CLO, and this one is starting with CLO, right? So just little bitty things that may work for you. We are going to end that right there. Before we get out of here, I want to make a couple of announcements to you, and I shared this in the beginning of the video, but I'm going to share this again for some of you latecomers who may not have gotten it when I came or when you came in. But we are giving away this Mosby's book, okay? You guys have made it known to me, hey, Lindsay, I need some help, you know, paying for this. I need some help with my resources, so on and so forth. And with that being said, I wanted to make sure that we let you know that we're here to help you. We're not here, you know, to make this thing hard for you. We want to make sure that as much as possible, we help you and that you understand that you don't have to do this thing alone, okay? And so tonight, I want to give you more details on how you can win this free book. The first thing you need to do is subscribe to our YouTube channel, okay? The link has been put inside of the chat. And then the second thing that you want to do is go to your favorite video and make a comment, okay? A positive comment, please. Comment on it. And then once you do that, you have been entered into the giveaway, okay? We are going to announce the winner on Wednesday. You have until tomorrow at 6 p.m. to do this, okay? And then Wednesday morning, we're going to announce the winner, and we're going to put this in the mail and mail it to you, okay? This is yours. It is beautiful. It is a very brand new book, and it's going to be yours to keep, okay? Ask us about our September discount. So another thing that we have done is I've also had some individuals say, hey, I want to book some one-on-one tutorial sessions with you, but unfortunately, I cannot afford to do the all three bundle at a time. I can't afford to do the bundle payment, so I just want to book one session. What we have done is we have removed the bundle requirement for the month of September, which means that if you would like to book a one-on-one tutorial session with me, you can do that now by just paying for one session at a time. And each session that you are with me, remember my sessions are 60 minutes in length and they are $30 per session, okay? And so you have the opportunity to work one-on-one with me. I am going to be here to hold you accountable and to hold your hand while you are making it through this. You're also going to have some access to PTCB free practice exams and things like that, okay? So I want to make sure again that you are getting in for this and that you are making sure too that you're taking advantage of that tutorial session special while it's lasting, okay? You may also say that, you know what, I'm getting ready to take my board exam. I don't really have time for tutorial sessions. I understand. But if you would like for me to go through a rundown with you before you take your test to make sure that you are okay and ready, I will do that. I'm excited to work with you. Okay. So I will make myself available to you as much as I possibly can. You guys are on the right path. Everything that you have done in your past have prepared you for this moment. Never doubt yourself. Don't doubt yourself. Don't doubt what you've been through. Trust the process. You are on the right path. It doesn't matter how many times you passed or failed a practice exam, or how many things that went wrong in the past. You're right where you need to be right now. And so we want to make every day count. And remember, those changes are happening in 2020. And so let's tackle this before 2020 comes so we can beat the odds. It has been a complete pleasure, a complete joy to work with you guys tonight. I enjoy every opportunity that I get to give back and to serve you guys in this capacity. Again, you're on the right track. Keep studying, keep doing what you're doing, keep sharing information, and you're going to get to where you need to be. I wish you guys the very best. And until next time, have a great night and continue to study. Have a good one. See you soon.